All right. Welcome to the Softwave TRT Workshop. I'm Dr. Jake Shupe. I'm excited for the things that you guys are going to learn about this amazing healing therapy this evening. I found this like 3 years ago, and this has hands down changed my life. So I was dealing with a very severe ankle injury. I was doing a lot of running, a lot of marathoning, and I had such a bad flare up that I couldn't even run for like a month. I wasn't even jogging at the point. And I found out that one of my friends, another chiropractor, had a soft wave machine. I went to go see him, and it only took like 5 minutes to do, and immediately I knew that something was different. I could like move my ankle around completely. The pain right in the middle of my ankle was gone. I was kind of jumping up and down a little bit, just testing it out. Um, I felt so good that I went home. And again, after not running for like a month, I went and I ran 10 miles that day. Now, I shouldn't have done that much, but like that's how good that I felt, that I immediately noticed a difference. In fact, I told Dr. Christie, I was like, babe, we have to invest in one of these machines for our patients. We have to invest in one of these machines just for my own health over the next decade of all the, you know, things that I've done to my body over the years. So it made such a sudden impact on me that I knew that I wanted to get this for our community and for myself. And I'll share one other one. Once we got it and I was testing it out on all different body parts of things that I've messed up over the years. I had biceps tendonitis in my right arm that I injured with from weightlifting in college. In fact, I had dealt with it for over a decade. And I couldn't do any bicep curls. Like maybe every 2 weeks, I could lift like 20 pounds. Otherwise, if I did more than that, it would flare up. So I started using it on my arm, and within like 6 months I was back to full strength weightlifting. Now a couple years later, I'm doing 35-pound dumbbells, like 3 sets, and doing more weight than I have in a long time. So this has helped me in a tremendous way, and I'm excited to share it with you guys this evening. So let's go into what some of the outline is tonight and what we're going to talk about. um, there we go. So first, we're going to go into what is a shock wave, just a little bit of the science, not too much, and what are the benefits? What exactly can it help with? I listed off a couple things that it helped me with, and is it safe? Why is what is Softwave compared to other shockwave on the market? So why is it the best? And then also how it compares to some other modern treatments for similar conditions. And then at the end, you guys are going to have an opportunity to schedule a Softwave appointment at a super discounted rate. So you'll certainly have a chance to be able to do that after you hear everything tonight. And I mentioned this to a few of you guys a couple minutes ago, but we're gonna raffle off a free discovery session. That's a $350 value. Somebody's gonna win that tonight. At the very end, we'll pick a winner. And then also, I would take some notes. If you're a note taker, this will be second nature. If you're not a note taker, I would jot some things down, especially some things that you want to remember. The more that you engage, the more that you're going to get out of it this evening. So, definitely a big fan of that. All right, let's do it. So, first, what is a shock wave? You might have heard this word before. I'm going to break that down just a little bit. All right, so I'm going to read this and then I'll kind of do some explaining a little bit. A shock wave is a type of propagating disturbance or a force that moves faster than the speed of sound. Okay, and the speed of sound is 767 miles per hour. And I'll give you an example. So on the left, you're going to see a picture of a jet that moves faster than the speed of sound. That's ultrasonic flight. That creates a sonic boom. That sonic boom from traveling at that speed is a shock wave. Okay. So basically, this shockwave machine, which um, Softwave is the brand, Shockwave is the type of therapy. So if you've been confused about it, hopefully that clarifies it again. Shockwave is the type of therapy, Softwave is the brand of machine that we're talking about tonight. So when we use the shockwave machine, it's sending a force at a very, very high speed. So 767 miles per hour in the air, but the applicator that we use, it sends it through water, which it travels even faster. So 3,355 miles per hour is the speed of the shockwave that you would be receiving from this treatment. And I want to show you a couple graphs that explain a little bit more on this next chart here. So on the far left, this is a what I call a true shock wave, a very powerful, high speed and quick shock wave that our machine uses. In the middle, you're going to see a radial pressure wave. And technically, this is a shock wave, but you can see, and I'll explain how has a very different outcome. And then on the right-hand side, you're going to see an ultrasound. Sometimes I'll get asked questions for people like, oh, is this like ultrasound? No, this is very different. The science behind it is different. The wave behind it is different. The benefits are very different outcomes. So shockwave therapy is not like ultrasound. But these two on the left are a shockwave. There's some machines on the market that'll use these pressure waves, these radial pressure waves, and you can see in the middle chart how the pressure goes up and then it comes back down over a moderate, I mean, it's still quick, but it's over a moderate amount of time. But the far left one, look at that spike. Look at how high it goes up in a quick amount of time and then it shoots back down. That, my friends, has a much different penetration level into the tissues, and it has a much bigger biological effect on the body. And so this is a true high speed, quick shock wave that our machine uses. So basically, to recap, a shock wave is a force that is moving faster than the speed of sound. All right, what does it do? What are some of the benefits? How can you benefit from it? So, of course, you can read them off the screen. I'm going to give you a little bit of extra insight on this. So, number one, it increases nutrient-rich blood supply by up to 300%. And just by doing that, that's going to help improve the healing process. So, getting nutrient-rich blood supply to the area is of crucial importance, especially for things like ligaments and tendons that have poor blood supply. This is big. Also, it helps decrease inflammation and pain. It helps stimulate and activate your body's own stem cells. So this is one of the key talking points. One of the things that's such a big deal about the Softwave machine is the fact that it boosts your body's own stem cells. And stem cells are repair cells. And a stem cell can turn into any different tissue type in the body. So let's say you tore a ligament. The stem cells can help repair a damaged ligament. But what if it was a tendon, like in my bicep? It can also help repair a tendon. If it's a bone, it can help repair bone. If it's cartilage, it can even help repair cartilage. So it can help with a myriad of different tissue types. So it's non-discriminatory in the type of injury that it can help, which is really cool, especially for people that have an injury that has like two or three different problems in one. Like you have tendonitis, but you also tore a ligament and there's arthritis there, like it can help with all two or three things at once. And that's what's so awesome about these stem cells. And that repairs, remodels, and regenerates tissue. It accelerates wound healing. It has an antibacterial effect. Not that we necessarily utilize it for that, but it does have an antibacterial effect. Reduces acute and chronic pain. So, an acute pain, that's like, okay, you sprained your ankle a day or two ago. That's a new injury. It's acute inflammation, new problem. Can help people recover very quickly, get back to normal very quickly the sooner you use it. This is great for athletes, uh, people that are in sports or performance, that can have a big impact on new injuries, but also chronic long-term issues. Like let's say you had knee pain and arthritis in your knee for 30 years. Amazing results with even long-term types of pain. I'll move out of your way a little bit here. Bottom, it's non-invasive. You don't hardly have any downtime in just from the treatment itself. No anesthesias or anything needed. So non-invasive, like it doesn't damage, it doesn't break the skin. There's no needles involved. It doesn't, there's no cutting. It's just merely topical on it's surface level touching. So, some amazing benefits from the Softwave therapy. All right, what can it help with? I mentioned a few things already. Like for me, it was biceps tendonitis and chronic ankle pain. So, elaborating a little bit more on the shoulder, multiple different shoulder types of injuries. Frozen shoulder. I've had people come into the office that literally couldn't raise their arm even to 90 degrees. And not always, but there's been multiple times where they, in one session before they left the office, they were raising their arm completely above their head. Those are some really cool ones when that happens. Uh, Rotator cuff injuries, chronic arthritic shoulder, frozen shoulder, pretty much any shoulder issue. Very common things we help with. Knee pain, again, acute or chronic knee pain. I've even helped a lot of bone on bone cases or people that have a lot of degeneration and arthritis in the knees. Now, am I telling you that in 6, 7 weeks that we're going to regenerate 30 years of damage in there? No, that's not what I'm saying. But what I am saying is I've seen people with bone on bone knee pain that couldn't even walk across the flat floor that are now walking normally, going up and down their stairs in their house without pain and not having to have knee surgery anymore. So we've helped people avoid surgery and also just again, live more of a pain-free life. Super high success rates with knees. They're probably one of the most common things that we work on, but it can be used on the spine. We're a chiropractic office, so the neck, the back, sciatica type of problems. So sciatica is from a nerves that stem from the lower back that shoot down your butt, your legs, can go all the way to your feet and your toes. Sometimes it presents as numbness and tingling. Sometimes it presents as pain itself or a burning. And when we utilize it right on that lower back area, we've even seen sciatic cases resolve or improve tremendously. So it can be used on the spine in conjunction with chiropractic care, works really good for that. Uh, Neuropathy cases, neck and upper back issues, elbow pain. So golfer's elbow, tennis elbow, other types of tendonitis, arthritic elbow, you name it. Hand and wrist issues, including carpal tunnel. Like I had a massage therapist come into our office. She was having numbness and tingling in her hands and fingers, which oftentimes can be a neck issue, but in her case, it was coming from the wrist. And we did 6 or 8 soft wave sessions on her wrist, totally resolved, like 100% gone. and feeling a lot better. But it doesn't have to be carpal tunnel. It can actually be the bones themselves. Like people have really arthritic hands, troubles gripping things. They can't extend their fingers all the way. Very productive at helping with those types of situations as well. Tons of plantar fasciitis cases. So that's that fascia and that tissue on the bottom of the foot, especially waking up first thing in the morning, putting your feet down on the ground. It's super tight, a lot of pain, limping around typically. So good success rates with that. Also like bunions, um, and cysts, like cysts and bunions that will develop sometimes on the feet or other areas. And then heel spurs, posterior um, heel spurs, dorsal heel spurs, really good success rates of helping people be able to just put their shoes on again or walk with like not having to wear Crocs or sandals all the time. So that's been really cool to help people. Hip issues. Now, when people say hip problems, a lot of times they mean like the sacral iliac joint, which is, basically part of the spine. But, and that works great for that. Huge resolution there, but also in the ball and socket joint itself, where a lot of people have to, or they think that they'll need to get like a hip replacement or hip surgery. We've helped prevent multiple hip surgeries before from this. Works really good there. Post surgery too. So we talk about preventing surgery, but I've had people come in post knee surgery, post hip surgery, and help the scar tissue, help the healing process, and get pain free and stable quicker after surgery as well. So that's pretty cool. All right. I Some other things that it can help with. Most of these I named off already on the left-hand side of the screen over here. What else did I not say yet? Jaw TMJ issues, any type of tendonitis in the body, basically any body part of tendonitis does a great job with. I talked about the post-surgical recovery, great to prevent, but even with recovering there, sprains and strains, broken bones. I actually did use it on a hairline fracture on my foot, and it can be used to speed up even bone healing as well. The question with Softwave that I think is accurate is not what can it help with. The better question is almost what can it not help with? Like it can help with like almost any part of the body uh, that I've seen. In fact, there's usages like spas will use it for like med spas will use it for like aesthetics, like skin complexion, tightening skin, making it more radiant and tighter. They'll use it in PT clinics and some medical clinics for like pelvic floor therapy, even men's and women's sexual health issues. So we in our clinic stick to more of this musculoskeletal stuff, but they it's used for a wide variety of things in in the industry. So it can help with a lot. So I'm guessing pretty much everybody could probably relate. I know I can with at least a handful of things on here that I'd like to improve and have. Okay, so we went over the benefits. We've talked about the different types of injuries and the different body parts that it can help with. We can see like this works really good. Is it safe though? Are there side effects? Well, I copy and pasted these, and so these are some of the technical side effects, but I can tell you right away I've seen little to no side effects in my clinic. I'll read this off though. So Softwave is a non-invasive treatment that typically has mild and short-lived side effects. That's true. Number one, pain. Yes. there is some discomfort during the treatment. In fact, we're actually looking for that. We're wanting to elicit some of the discomfort areas. We're trying to pinpoint them. We're not going to like blow you away or anything like that. I've never had somebody that's not been able to complete a treatment. It has different power settings. If we need to bring the power down a little bit, we can. If we need to bump it up a little bit, we certainly can. But I've never had somebody not be able to make it through a session. In fact, we try to find some of the tender spots because that shows us where some of the damaged tissue is. The more tender areas are usually the areas that have the most amount of scar tissue. So we'll kind of hang on those areas and then we'll relieve it a little bit and then we'll go back to it. But yeah, there's going to be some discomfort during the treatment. You can expect that. But again, it ends right after the session and most people are feeling better after the session, like pretty much right away. Redness, yep, you're going to get some redness because it's increasing blood flow. Blood's red, so you're going to bring it to the surface. Swelling, I've had maybe one or two. Again, we've been doing this for 3 years. I think I've had one or two people tell me that they've gotten a little swollen afterwards. Bruising, never seen it. I've never seen somebody bruise after this. Skin sensitivity, once in a while, little little sensitivity on the skin. Burns and blisters, I've never seen it. So there is not one, I would not, there's not one severe side effect that I've seen, and certainly not any that have been ongoing. Oh, actually, one that's not on here that is really important to know. If you're using Softwave basically from the neck up, you do need to wear ear protection because it's a shockwave, which is ultrasonic, meaning sound. It can damage the eardrum if you're at too high of a, if you're at a higher power and you get close to the ear, it could create like a ringing in the ears or tinnitus or ear damage. So if we are basically net above the shoulder, we have a couple different forms of um, ear protection for you to wear. Other than that, super duper safe. In fact, if the drug company could make a drug that had the benefits and the healing power of Softwave with pretty much little the amount of side effects that there are from this, they'd have the next multi-billion dollar drug, maybe trillion dollar drug on the market. Like that's how insane the safety and the efficacy of Softwave is. Okay, this machine right here is the machine that we have in our clinic, the machine that it's the gold standard when it comes to shockwave. It's had the most amount of testing, the most amount of research and trial times and everything like that. And just to paint a little bit of the picture of this compared to some of the other machines on the market, I put together this slide. So you don't be fooled by anything that just says shockwave therapy. So last year I had a patient come in and they're like, Dr. Jake, this clinic over here is offering shockwave therapy. They found it in the newspaper. And I didn't even know that people advertised in the newspaper anymore, but I read the advertisement and it was some machine that like I mean it was definitely one I'd never even heard of before. And so I started doing some more research and I was like, man, I really need to look into some of the other machines. Well, after some research, I've found quite a bit out about them. And in this scenario right here, looking at these different machines, we're gonna let price tell the story a little bit. Now, price is not everything, but a lot of times in life, you get what you pay for. So let's look at a few of these machines. So this machine right over here, this tall one on the far left screen, this Chattanooga, this is a $17,000 machine over here. Okay. This blue one on the far right, this is a $4,000 machine. This one on the top right, this one is 1,200 bucks. So you could go online, and I bet, a lot of Americans, if they wanted to, they could probably buy this $1,200 machine on the top right, this pulse wave machine. This one in right next to the blue one in the bottom, this Oceanus, this is a $10,000 machine. So 17,000, 10,000, 4,000, 12,000. That's a pretty big range right there. Do If you were buying something, would you expect to get the same benefits, the same results from this $1,200 machine as you would from the $17,000 machine? No. Like most people would not expect that. And that's because for that big of a price difference in machines, there's got to be some substantial difference there. Like it's more effective, it has a deeper penetration, the results are better, it's going to last longer, it has a better warranty, something about it, right? Yes, that absolutely tells a story. Well, the same is true in comparing even this model, the Chattanooga on the far left, to our Softwave machine. So this is an $85,000 machine right here. And let me tell you that pretty much most of the research and the publications, they've used the soft wave machine. So if you're saying that shockwave itself, the type of therapy, can yield this result, like it's going to help with this condition and it helped this percentage of people on this condition and that, and then you do the research with this type of machine, and then you buy a substandard machine, like it's not appropriate to say that it can help with all those types of different things. So you just got to know what you're looking for and that not all of them are created equal. And let me tell you, even though that this was a big investment, it hands down, I've never regretted it. It's worth every single penny. Even if I never, even if I never used it to help generate income, even if I spent all that just to help my health issues and the things that I've dealt with over the years, I would have still bought it because that's how much it's helped me. And I'm really hopeful to be able to share it with more of you guys. So you just got to know that they're not all created equal, and don't be fooled just by anything that says Shockwave on the market. It's just good to know. All right, Softwave. Another reason it's the gold standard. It's used by the top professionals and some of the top people in the medical industry or health and wellness industry. So pretty much the Major League Baseball teams, the NBA, the NFL teams. You can just see a few of the NFL teams that have one of these machines. Dallas Cowboys, the Steelers, the Saints, the Dolphins. I mean, these are players that make tens of millions, sometimes hundreds of millions of dollars. When it comes to performance and recovery, they don't mess around. They are looking for the absolute best because they have the money to pay for the best. Um, Mayo Clinic, Stanford Medicine, Walter Reed Medical Center. I mean, you name it, it's been pretty much featured a lot of different places. And this isn't a brand new technology. Sometimes people will ask me, like, is this technology brand new? Is it backed by research? Well, the Softwave machine was actually developed in 2004, so over 20 years ago now. And just within the last 3 to 5 years, it's become more mainstream, more well known. They've marketed it really well, and the results speak for themselves. So 240 scientific publications and 98 different research institutions, over 20 different countries. There's a lot of data. In fact, you can find a lot of, if you just are searching for can Softwave therapy help with blank. I mean, I'm blown away how many different things I've searched that has research, that has findings and research that it can help with, which is pretty cool. So we've got that going for it as well. Let's compare it to some other options. And I think when comparing it to other medical approaches, best way would be to just like use an example. So since we help a lot of knees, I'll just use a knee pain example. So let's say you had chronic knee pain, you've had it for 10 years, and you are wanting to get some help with it, right? Well, one option is you could just take pain medications. It's a very cheap option, very affordable, but of course, you're never actually pain medications, they'll never actually help. They're never healing the knee. They're never a long-term solution. They're only masking the symptoms. A lot of people know this, of course, but there's also known side effects, proven um, like for sure side effects to pain medications. Again, very cheap. Most everybody can get pain meds, but it's not going to do anything for you. Cortisone shots. These are recommended or given, I should say, like all the time for all sorts of different things. Get a cortisone shot. If you're lucky, you'll get 3 months of pain relief from a cortisone shot. I've heard some stories of it going longer. A lot of stories, though, they're very hard to administer. I would not be want to be somebody who administers them. Majority of the time, they don't. It's hard to get it in the right spot, and you're getting little to no pain relief at all from it. The thing that is not often communicated is the side effects of them and what the cortisone shots do. Well, they break down cartilage. So if you have a knee problem, you probably already have a cartilage issue. And the more you get of them, the more cartilage it's going to deteriorate. So long term, it's actually going to make you worse. The other thing they don't tell you is that these cortisone shots, these steroids, they weaken your immune system. And so then you become more susceptible to colds, flus, viruses, sicknesses, and other diseases. So again, cost cost effective to be able to obtain one, but neither of these are actually going to help the area heal and are and have proven downsides. And I just don't recommend. Another option for this, again, example of chronic knee pain would be stem cell injections. Now, this is something that actually will help the area heal. It will help the area improve. In fact, I've got friends that do stem cell injections that have gotten them personally, great results, and friends that use these in regenerative medicine clinics that administer them and see great results. They work. There is some downsides. You do have to deal with needles. You do have to get some injections, so it is somewhat invasive, not highly, but you're going to get needles. They take a while for them to get full effect, for them to take full effect. They take a while. I mean, the biggest downside that with them is they are costly. So for like let's say one knee, one treatment area to get good stem cells, that's going to range between 6,000 and $11,000. But they work and they do a good job. Surgery, that's always going to be your last resort. Again, it's the most invasive, it's the most amount of risk, not just going under, anesthesia and going under, but risk of infection. And let's be real, with a knee surgery, a knee replacement, they're literally sawing the leg off, putting in a metal knee, stitching you back together, and I mean that's what happens. So there's going to be, of course, your recovery time, which recovery time these days is definitely better than it used to be, but it's the most invasive. And the patient satisfaction outcomes from hip and knee replacement surgeries are not very good, in my opinion. Like 50% of the people that get them say that they're glad that they did it. I don't know about you, but like that's not good enough for me. If I'm going to go under that much risk and take that big of a case, I need to either be dying, like I can't imagine another day with that amount of pain, and I tried everything else already, or I'm going to need something better than a 50% satisfaction outcome. And cost wise, uh, oftentimes these can be covered by insurance, but oftentimes they're not all completely. I mean, even things that are covered, you can have cleanup costs from surgery that were unexpected cleanup costs for thousands of dollars, $10,000. So you don't always know. So you're looking at all these different options. And then like compared to Softwave, the reason that I like Softwave for so many of these different um, healing areas is that it's non-invasive. You're not dealing with any tissue damage whatsoever. There's no needles, super fast recovery time, and getting back to functionality quicker. And even in the other big thing is that cost. Like take one of the most severe knee issues that I've seen. You're looking 75% less cost than even the stem cell injections. And you're getting some of the same benefits of them. So that's what's so cool about um, Softwave is it's the best natural, non-surgical, non-invasive chance that you have to actually fix a problem with these types of injuries. So if that's something that you think could help you or you're interested in, or maybe that your spouse or your child or somebody that you care about is dealing with one of those things and you want to schedule your first discovery session, here's how you can do it. And here's what it looks like to be able to do that. So the first step, you schedule your appointment, you come into the office. Here's what's going to happen. We'll do a consultation. I'll do a physical exam on that area or an orthopedic exam. We'll take any necessary x-rays. We don't always need to get x-rays, but sometimes that we do. I'd say probably half the time of what people come in with will need to get an x-ray. It just kind of depends on the scenario. Or if you've had a recent x-ray on it, sometimes we can use that. So consult or physical exam, any necessary x-rays, plus you get your first Softwave treatment that same day. And that's the whole first appointment. That's a $350 value that we get you guys for just $49. Now, why is it only $49? Because I want thousands of people in my community to at least be able to try this out. Like if it can help me even half, or if it can help you like even half of how this has helped me, like this is going to be more than worth it to most people. And I want everybody in my town to know what soft wave therapy is and what it can do for them. So we make it super easy to get some insight about what's going on with their body and at least try a session. And then after that session, what we do is we schedule a follow-up appointment, ideally within 24 to 48 hours after your first session. And then when you come back, we'll do a few different things. Number one, I see how you responded to your first treatment. I would say 75 to 80% of people noticed some sort of improvement or benefit like that day and the next day. So I want to see how you responded. We'll also go over your exam findings we'll look if we took x-rays, we'll look at those together as well and show you this specific area and your recommendations. Like how many sessions is this going to take to get you back to full functionality? Like if it's an acute injury, it might only take 4 sessions. If it's a longer term problem, it could take 8, maybe 12 sessions, depending on the severity of the case. So we'd go over how you respond, exam or x-ray findings, recommendations, and then cost and see how we can make something work for you. I'll give you a couple different options about what you can do cost wise. And I'll tell you, I've helped people from pretty much every income range that you can imagine. I've helped college kids also paying off student loans. I've helped retired and disabled veterans before. If you're committed to getting better, I'm confident we could figure out some sort of option that'd be able to work for you. The first step is just setting up an appointment, getting the test, getting the examination, and trying out the first Softwave session and going from there. So if that's something that you want to do, you can just text the word Softwave to this number right here. So you can text the word Softwave to 563-275-8719. And then we can find a time, get some details, and get you on the schedule to be able to do your discovery session. Whether you're watching this live right now or you're watching the recording at a later date, this you can still text this number at any time. Just text the word Softwave to that number right there on the screen, and we'd be more than happy to help you answer any questions that you have and kind of walk you through what that looks like to get better, because that's what we're looking for.